Hello, I'm Dr. Clint Sexton with Naperville Integrated Wellness, and I'm a functional medicine practitioner. Today we want to talk about fibromyalgia. Now, typically, if you look at articles or go to websites regarding fibromyalgia, they mainly just focus on the pain part of it, and how it's affecting the nerves, and how your nerves are sending that information to your brain, and how that pain is being perceived, and basically saying it's an amplified or exaggerated response to stimulus, whether it's actually something that would cause pain or not cause pain. So I want to go into more detail about what's happening with fibromyalgia. It's not just talking about the nervous system and pain. We're actually talking about the neuroimmunoendocrine system. So what that means is we're talking about the nervous system and the immune system and the endocrine system, which are all the hormones, okay? So we now know that all of those systems are involved, but we actually take those three systems and refer to them as a neuroimmunoendocrine system. So there's much more going on with fibromyalgia than just this concept of the pain associated with it. And a lot of the treatments are directed at the pain management, either trying to help dampen these pain signals, or you're using some type of physical modality like using heat, or maybe a little massage, or even physical therapy. But that's just treating the symptoms at the very, very end of this whole process, instead of going back and looking at what are these root causes that are ultimately resulting in fibromyalgia. So again, we know that there's connections with what's happening with what's going on in the brain itself, what's going on with the spinal cord, how these impulses or nerve impulses are being perceived by the brain as pain, but there's lots of other symptoms that go with this. So you may have issues with just chronic fatigue, or problems with sleep, or problems with mood. There's more going on with this than just the pain part of it. So we have the nervous system, then we have the immune system that's involved with this. And so the immune system is also going to affect how the nervous system is going to behave in this scenario. And since fibromyalgia also affects women much more than men, we know there's a hormonal component, but not just things like estrogen and progesterone. Yes, we factor those in, but you have other hormones as well. This is going to influence thyroid and how thyroid hormone is going to work. You also have hormones from your stress glands or your adrenal glands called cortisol, and there's other chemicals coming from the adrenal glands that can influence this. So you have to look at all three of these systems, okay, if you really want to get a better understanding and get down to more of the fundamental root causes of what's leading to this imbalance we call fibromyalgia. The last part of it then really talks about is the long-term effects that this has on the brain itself, and that's probably the most concerning, at least when I'm looking at it this way. Because yes, you have the present today physical discomfort and other related symptoms with this, but if you look at the blog, you're going to see there's a lot of permanent changes that are occurring in the brain. Essentially, you have a chronic state of inflammation in the brain. That's going to be damaging to brain cells. That would put you at increased risk for dementia. This would put you at greater risk for Alzheimer's or Parkinson's. But we also know that we just see a decrease in brain size. So due to this chronic inflammatory state, you're losing neurons over time at an accelerated rate over someone without fibromyalgia. So it's not just the short term, these are the long-term concerns and these permanent changes that will occur to the brain. And that's really that whole second part I wanted you to be more aware of, not just what's happening today, but what's going on in the environment of the brain because of the imbalance of what's happening with the nervous system, with the immune system, with the hormones in your body. So if you'd like some more details on this, you can check out the blog. It gives you more information about just standard treatments. It also goes into more about how we would look at some of the systems and underlying causes we'd be wanting to address from a functional medicine perspective. Hope you found this helpful.